Hi folks, Dave Eckmann here, President and CEO of the Greater Wausau Chamber of Commerce, here for our next segment of the 2-minute drill as we talk about the unhoused population, homeless in the city of Wausau. And we've had a few discussions on this already, and so we're going into our third segment today. And with us is Tracy Rieger, the Community Outreach Specialist for the Police Department, City of Wausau. And thank you for your time and being with us today.
Thank you for coming in today and talking about this super important topic in our city and a topic that has been in the headlines quite often lately.
Absolutely. We've shared with our audience that where we are at the depot, we see it every day. We see it on the tracks, on the railroad tracks, or on Washington Street. So from your position here, how long have you been now in this role with the City of Wausau?
I've been in this role for about 1.5 years. Prior to this, I was the director for Catholic Charities homeless shelter here in Wausau and other parts of the region as well.
Okay, so you come highly regarded throughout the whole community. You're very well respected in your ability and what you do. Could you describe briefly for our audience what it is your role and duties are?
Sure. So my days are not typical. There's no 2 days that are alike. But my role here is to really do street outreach to our unhoused population and get them the resources they might need to get themselves in an empowerment situation to get out of the homeless situation that they're in. Those services range from, ID recovery. So I'm helping people regain their IDs, their social security cards. We're talking through their mental health history, their medical history, and I'm connecting them to services through North Central Healthcare, through the ADRC. We are linking them in with primary care providers to get the medical attention that they need. A lot of our unhoused population are struggling with diabetes, high blood pressure, seizure disorder, some of those really important medical topics that need to be addressed. In addition to that, we talk about housing, and when we do that, we talk about what it is that they're looking for. My idea when I'm helping somebody isn't to tell them what I think they need, but rather ask them what it is they think they need, and then I help give them the resources to achieve that.
Terrific. You shared some data with me, and it's comprehensive. But what it does outline is that there is a growing population here of unhoused and the lack of capacity for them for shelter.
Sure.
Could you share a little bit about that in terms of what you've seen over the last 9 months?
Sure, absolutely. Well, I can even pan it down a little bit closer than 9 months, but I think that this data that I'm about to share is a little bit more eye-opening, if you will. But from January this year, from November of last year through January of this year, we saw 100 unduplicated guests enter the Good Shepherd Shelter, formerly the Wausau Warming Center, as new clients to their services. That's a huge number in 2 months. In the month of February, there was almost a brand new unhoused client going to Catholic Charities for services every day of the month of February. So as we look at the trending population in our city, it's growing a lot faster than we probably have the services to help with that. That statistically nationwide, they say that, your numbers can double in 5 years. At the rate we're growing, I think we're growing much quicker than that. So it's really important for the city of Wausau, the residents of the city, to understand what homelessness is and, understand that we are dealing with a population that's growing, it's not diminishing, and there's lots of reasons that surround the reasons why they're here.
Mm-hmm. So when it comes to resources, we hear a lot about that. We heard a lot about it when we were at the council meetings the last couple of weeks, where you have wraparound services. And we visited with Craig Vincent at Bridge Street Mission and what he's trying to design out there. Can you talk about the importance of those wraparound services?
Absolutely. So our community is very resource rich. We're the central hub of this part of the state. And that's why we get a lot of individuals coming to our city to receive the services that we have. Unfortunately, with the number of people that are coming into our community that are unhoused, it's watering down the effectiveness of the services that we have. In my work, I feel it's very important to do soft handoffs to other agencies that provide services. So we're not just throwing these clients to the wind and saying, go here and do this. What we have found in working with this population is that it's really important that we understand that they may not have the ability to just know where to go and what to do and the questions to ask. So really it's hand-holding to the next step of the process. We have mental health services here through North Central that are great, but it's not enough. We have alcohol and other drug resources here, but it's not enough. So really it's the city and the county may be working together to provide a more robust mental health AODA healthcare system and an accessible one. When I'm working with clients who are super vulnerable, their window of opportunity to want to get that help is very small. So if we have to wait, a month for a bed to open or something like that, we've lost them. So that's what I mean by accessible. It's great that we have those, but if we can't access them the minute we need them or very shortly after we're talking to our client who needs that, then it really is a source of opportunity missed.
Okay. Over the last couple of weeks, we had conversations at the city council, and Chief Barnes approached to hire 2 additional law enforcement officers because you are not an officer.
I am
You
not.
cannot enforce the law.
Correct.
Per se. So we went through that. Could you talk about the importance of those 2 officers and the role that they're going to help you?
Absolutely. So, when we talk about the officers, there's been a lot of controversy surrounding, it criminalizing our unhoused population and things like that. And I'm not here to get into that part of the discussion, but I will say this. As a citizen of the city of Wausau myself, there are certain behaviors that if I, whether I'm unhoused or not, do, I have to be held accountable for those actions and those behaviors. The addition of 2 officers is really the issue surrounding that is to really combat the behaviors and the actions of things going on downtown. It's not all the unhoused, but a good portion of the issues are coming from that population. So it looks as if they're being targeted. The true reality is we need to have everybody held accountable for their actions. And if that requires 2 additional officers so that we can free up the officers that are supposed to be on their regular sectors and their regular beats doing their good work in those areas, we have the ability to do that. On any given call, it could require 3 to 5, maybe even more officers to respond. So in that situation, those officers are being pulled off of other areas of the city who, as a taxpayer myself, are paying my taxes to go toward those services. And I might not be getting the best services that I should be getting because the officers are constantly being pulled away. So this is an effort to really make sure that we are providing the whole city with the amount of policing that needs to be in the community.
Yeah, thank you for you brought a lot of clarity to that from your position here.
When I first started, the majority of the unhoused were like 40, 50, 60-ish range. And I remember that really stuck out to me because my parents at the time that I started that job were in their 60s. And I kept thinking to myself, like, wow, this is like my mom and dad being homeless. It really hit home to me. So that was our population when I first started. And then the population moved into a younger crowd. So that trended a little bit younger. Then we had a huge spike in female. 2020, during the pandemic, we had a huge spike in female population. And now it's trending back down to the younger crowd, so 20s, 30s. We know what the problem is. We know that it's mental health and drug related. We know that in the month of February, there was 90 guests in the shelter across the street, and of that 90, 16% of them were employed. They had jobs. They were going to their jobs every day or part-time, whatever that is, and they're in the shelter because they can't find housing. So, I think that if we could somehow get transitional housing into our community for both men and women, there has to be housing options that go from shelter before a signed lease. There has to be something in between. We don't have adequate wraparound services in place. We need case management. We need more people to wrap their arms around these individuals and provide them the help that they need. So that's one of my hopes. The other thing is, like I said, we need more mental health in AODA. It's a must. And I know you brought up Robert Marbet.
Yes.
He is fantastic.
Yep.
I did go to that listening session. I did meet with him one-on-one. I've been having conversations with him offline. And I think that his strategies and his suggestions are not rocket science. We can do this. But it's going to take a lot of alignment in the community to get it done.
Is there anything else, Tracy, that you would like to share with our audience before we depart this conversation?
Yeah, I think it's really important that we also spotlight, if you will, the unhoused female population. I know that Chief Barnes went to City Council with CW Solutions for a conceptual transitional housing program for our unhoused female population. And I think that's really important to note. In 2 months' time, so November 1st through December 1st, the Good Shepherd Shelter was able to produce a number of 118 unduplicated guests that entered their shelter. 25 of those were women. Of that 25 women, they were polled to see how many of them have been a victim or survivor of domestic violence. And a staggering 80% are victims or survivors of domestic violence. Putting them in a situation where they're in commingled sheltering, it's very traumatic. And the rate at which the female population is being victimized, even in their unhoused situation, is really, really high. So we're seeing a tremendous amount of exploitation, sex trafficking, increased domestic violence, et cetera. And for women that are coming into the shelter system with that history already, the amount of trauma being placed on them additionally is just unacceptable, in my opinion, for them to have to live like that. So I hope that there's a lot of support surrounding the transitional housing that's being presented to the city.
Thank you for sharing that. Most people don't understand the complexity of the work that you do. And I'll tell you right now, the people that we've met, when we started this, folks, we talked about the exceptional human beings doing fantastic work for people in this community. And you're one of them, Tracy. Thank you for all you do. And we will continue this conversation, but I truly want to express what we can do to help you. We should all reach out if we can to help Tracy in the work she does here. And thank you very much.